Senator Peters. Senator Murray.
Thank you very much, Chair Hoeven. Look forward to working with you on this really important committee. You know, Commissioner Makary, the FDA has a really important job to do. Lives literally are at stake, and that work requires the utmost diligence and care and commitment to following the science and uploading FDA's gold standard. We all expect to walk into the drugstore and know that what we are buying has passed a safety and efficacy standard, and we have to be assured of that, and we have to be assured that the work's been done, that we don't have to question that. So I don't think it's careful leadership when you do mass fire 1 in 5 people across FDA, only to frantically then bring some back because you didn't stop and think 2 seconds about whether those jobs were actually important. We really, Mr. Chairman, cannot cheap out on the FDA and expect to maintain that gold standard. That means that people know that drugs are safe. We can't just cut and hope nobody gets sick when you're slow to issue a recall, or hope no one needs that medicine that had its approval delayed, or hope there isn't another infant formula issue while your staff are getting fired or getting rehired or wherever they are. This work really takes investments. This committee knows that, and it expects expert staff, like the people that have been shoved out the door. Drug approvals are already getting delayed. Food and drug safety inspections are lagging behind. We are going in the wrong direction fast. We still have yet to see from you a full budget request. That is unacceptable. You are now testifying that the budget proposes to slash FDA by more than 11%. That's actually news to all of us, and I'll tell you right now, it is not going to fly. It's reckless, and it's not going to happen as long as I have anything to say about it. Now, Commissioner Makary, when it comes to your mass firing of FDA employees, in April you said, quote, "I can tell you there were no cuts to scientists or inspectors." Well, that is not true. I think Senator Ossoff covered that, and I think the point here is that all of this firing and rehiring, I don't see how that's efficient. Frankly, it kind of shows that you don't know what you're doing and that you're breaking things in the process here. And so let me ask you a question, and hopefully it is an easy one for you. Does it save taxpayer dollars to fire staff who work in centers that are fully funded by user fees, not taxpayer dollars, yes or no?
Nice to see you again, Senator Murray. You asked me to do an assessment of the staff when I came here for my confirmation hearing. And I hear that you're criticizing me for bringing back some individuals after the cuts that I was not a part of.
No, I'm saying that's good. I'm just saying in the long run, this has been very inefficient. But my question to you is not about that. And I know you've covered it with several other members. So does it save taxpayer dollars to fire staff who work in centers that are fully funded by user fees, not taxpayer dollars? Is that efficient? Does it save money?
The cuts were to HR, IT, communications. There were 2,600
But they're funded by
HR
user
staff.
fees. They're funded by user fees.
In part.
It is not saving any money.
In part.
Well, many of the staff you fired were in centers that are actually fully funded by user fees. You know that, correct?
So if we have 2,600 HR people, do you want me to not make any cuts
No,
to
I'm
that number?
asking you a specific question about the centers that are fully funded by user fees.
That's one center. It's the tobacco center.
Well,
and so
okay, well, let me
you
just
said we
say-
can't just keep cut and cut. We can't keep hiring and hiring. The agency doubled since 2007. So let me ask you, what is the right number of employees?
No, you're
at the
here to
HR?
answer my questions,
Okay.
sir, and I'm going to ask some more. Without critical support staff you fired, inspectors cannot plan their trips. They cannot do their jobs. I want to ask you, what % of planned inspections has FDA missed since those April 1st firings?
In the 12 labs that we have that evaluate food products in the food inspection realm, there are no, as of last week, I just did a check, there are no backlogs. They are running at 100% efficiency. There are no drug approval delays, despite the, what people want to attribute.
That is not what I have been told. I have been told, and I would like you to go back and check and report back to us, because we know that some of the planned inspections at these that were supposed to take place have been missed. And to me, why that's so important, if there is not inspections, the public doesn't have the information that they need. I am going to run out of time, so I want to move on.
Yeah, there were no cuts to inspectors.
Will you go back and check for me, please?
Absolutely.
I understand, and by the way, inspectors one thing, but if you don't have the support staff to make sure that they know
Yeah, but
where they're going.
2,600 HR staff and procurement staff?
I understand that the FOIA staff producing documents related to ongoing litigation by the Children's Health Defense, Senator Kennedy's organization, were shielded from the RIF, while other FOIA staff are responsible for FOIA responses at other FDA centers were targeted for termination. Is that true?
That's not true, Senator. We have our FOIA staff. They continue to work at the FDA. I've made sure that all the FOIA staff at the FDA are doing their job. We are also using AI to reduce the burden on that staff.
Well, for the record, my understanding is that the Children's Health Defense FOIA staff were not fired when other ones were.
All the FOIA staff are there.
And that seems like a real conflict of interest to me, considering that the Secretary's extensive history with that organization, Children's Health Defense, and his goal to remove authorizations for vaccines. So I just want that on
It's
the
not
record.
true.
Well,
All FOIA staff are in place.
okay, so if a study came out saying that people who took a certain medication experience a certain rate of, quote, serious adverse events, but the study's authors refused to say what they were counting as an adverse event, would that raise serious questions for you about the study's validity?
Yes, Senator. So I have the natural inquisition of a scientist that's done a lot of research, so I would want to see the underlying data, yes.
Okay. Well, I am, of course, talking about the sham study from the Ethics and Public Policy Center. It's an anti-abortion group. It's bankrolled by extremists. They fought to overturn Roe v. Wade. And this study, if you can call it that, is unsound and has been widely panned by medical experts. But days after its release, you and Secretary Kennedy are now suggesting that we need a, quote, complete review on the safety of mifepristone. Now, to be clear, mifepristone has been proven safe and effective in more than 100 studies over 3 decades. And the people that are now pushing that bogus study and saying that mifepristone is dangerous for women are the exact same people who think that abortion is never necessary to save a woman's life and that 10-year-olds should somehow be forced into childbirth. I believe that this administration is laying the groundwork to rip away access to medication abortion across the country. This has not gotten enough attention, and I know you'd prefer to keep it that way, but I want you to know I'm not going to let that happen.
I have not seen that study, Senator, and you have not seen that study.
Well,
so how can you call it a sham bogus study? Neither of us have seen the study, the underlying data, or the methodology.
Actually, that's not true, but I will say this. Mr. Chairman, we have a lot of differences here. I know you came before this committee to present your side of the story, but I am very clear that laying off people, cutting budgets, is not going to improve the safety and efficacy that we count on when we go to the drugstore to get our drugs. And I know that sham studies that try to prove a point that came from a political group is not going to tell the public that they can count on the medications they count on. Thank you, Mr. Chairman. I yield back.